cell surgical network branches all over the world. We have many in the States, more than 20 branches in the state. And this is the rest of the world where it's distributed in Europe, South America. There are branches in India, and of course, Turkey and UAE and Iran. Okay. So if a human being wants to survive, it depends on two systems. Number one, the immune system, and number two, the repair system. Right. Okay. Now, what is regenerative medicine? Regenerative medicine, as everybody knows, is the science of using stem cells and growth factor to repair or replace damaged and defective tissues and organs to create a living and functional tissue.
Okay.
Okay. What are stem cells? These are cells that are looking for a job. Stem cells function, they can proliferate, they replicate into more than stem cells. Stem cell can differentiate, they can turn into other specific cells or tissue, and these actions are based on signals or growth factor from the damaged tissue. Next, okay. What types of stem cells we have? We have adult mesenchymal stem cells, which are derived either from bone marrow or adipose tissue or fetal tissue or umbilical cord. We have embryonic stem cells. They are only derived from a dead embryo. And there are issues with embryonic cells, which they can cause tumor formation, and there are ethical issues. So it's probably now nobody uses them. The other type of stem cell are engineered cells. They are engineered, differentiated forward to look like some type of tissue, and they are induced pluripotent stem cells. They are engineered backward. What does that mean? Somatic cells, like any skin cells or fibroblasts, are taken, they engineered back to look like an embryonic stem cells. Okay, so what is the differentiation of stem cell, adult mesenchymal stem cell? They can form bone, they can form cartilage, they can form muscle, they can form nerve tissue, blood vessel, connective tissue, fat, and other tissues. Now, what are the sources of adult mesenchymal stem cells? How do we get, or from where we get these cells? The first origin is autologous. Autologous means from your own personal cells therapy, from your own body. It has the beauty and the advantage of autologous personal cell is they have the same DNA. There is no immediate or delayed rejection, and there is a lower risk of viral infection. The other type of cells are allogenic. Allogenic means are taken from other person cells. Now, adult mesenchymal stem cells and product either come from amniotic fluid, this is the embryonic, or from the placenta, or from the Wharton jelly, or umbilical cord. Okay, how does a stem cell work? So the way stem cells work is by the first property is by homing. Homing means the stem cell respond to an appropriate cytokine signals released from a tissue injury, inflammation, degeneration, disease, or any cell death. So there will be a cytokine signal for the cells to attract it to the damaged part of the body. Activation property, the cells promote, the stem cell promote cytokine mediated. They secrete like sort of hormone called a paracrine or autocrine effect to directly affect the neighboring cells or damaged cells to respond and heal the damaged part of the body. And the other way that stem cell work is by engrafting. Engrafting means it will be grafted for a damaged part. If it is a myocardial cell, they change into a myocardial cell. If it is a cartilage, they change into a cartilage. So differentiation into the specific cell type or damaged cell. Now, your cells are your own cells, and how do you get them is the surgeon usually transfer tissue from a stem cell rich part of the body to a damaged and stem cell deficient area of the body as a lipotransfer surgical procedure to promote healing. Okay, so what is the difference between an autologous cells and drug? Now, autologous cells, they are single patient point of care product, while a drug is a mass marketing product. The stem cells production or autologous cell, they are never a closed system, while a drug are made as in a closed system. Autologous cells could never be a GMP. The drug should be GMP produced. Autologous cells start with a living animal or a human that cannot be completely validated or for sterility and can in fact be non-sterile. While a drug produced must only use validated sterile products. If you have autologous cells, you can test the final product for a sterility, while it is impossible or impractical to test all final products for a drug. It is taken by, of course, it requires a surgeon, while a drug does not require a surgeon. Now, vascular stromal fraction, which is obtained by liposuction, called SVF, contain the following type of cells. So when you do lipoaspirate and do the stromal vascular fraction part, which is the diluted part, it contains pre-adipocyte, which is a mesenchymal cell. It contains hematopoietic stem cells.
Sorry to interrupt you, but many colleagues want to enter and waiting now.
Okay, so what are the content of the stromal vascular fraction which we aspirate from the fat? It contains pre-adipocyte, which is a mesenchymal stem cell. It also contains hematopoietic stem cells. It contains pericyte progenitor stem cells. It contains endothelial progenitor stem cells. It also has a macrophages, which has a very important role in as anti-inflammatory. It has a T regulator cells for immunity. It has endothelial cells, which is important to promote blood vessel formation. And the most important thing is also it has many growth factors. Now, what is the difference between a bone marrow derived cells and fat derived cells? I will try to summarize in this slide. The bone marrow is deficient and suppressed in chronic illness, while fat is not. What is meant here? Because the bone marrow has been active all life to produce cells, with the future, in the future, it will get a bit slow, it get slower, and the number of cell release from the bone marrow is lower. However, the fat remain dormant most of the time, so the number of stem cell in the fat is much more than the number of cells in the bone marrow. Bone marrow has less cells associated because of aging. Approximately, the ratio is less than 1,000 times less than the fat. The fat-derived cells are essentially effective in forming new tissue, like it can form myocardial regeneration or chondrogenesis. Bone marrow, of course, harvesting of bone marrow is more difficult, and also it hurts, probably painful, than taking the fat. And the good things about SVF, the particle is less than 100 micron, and that can be used intravenously. Now, bone marrow stem cells, you could see with age, you could see with the newborn, each 10,000 cell containing one stem cell in the bone marrow. But if you reach the age of 80, the number of stem cell is only 1 in 2 million cells. So you could see with time, the bone marrow get depleted and the amount is much less, unless you do expansion and culturing of the bone marrow. This is also the difference between bone marrow and fat. If you see the fat here, even at the age of 60, the number and the amount of stem cell is still about 80% of the cell. So this is the difference between bone marrow and fat. So what are the properties of stromal vascular fraction of the concentrate of the fat? It is based on homing and activation. The SVF is regenerative. The SVF is anti-inflammatory. The SVF is immunomodulatory. Why we use SVF? The stem cell bioaccessibility, where previously locked up cells are made available to repair damaged tissue. So as you know, all the stem cell in the fat, they are stranded by collagen fiber. They cannot move, and they are used only locally if the skin is damaged or fat is needed. So what we can use if we release them, okay. So a surge means we can use them as a surge, where super high number of stem cells are added to injured area. They can affect therapeutic changes. Again, it's okay, I can manage. Next. Okay, so that's exactly, this is currently what the stem cells sitting under the skin in the fat, where there are only very few of them are used. However, if you aspirate and you can re-inject them back into the body, which is look like a shower now. Let me admit anyone who is in waiting area. Do I need to admit people, Nasser?
No, it's okay, Doctor. No, I'm taking care of this.
Okay, thank you for that. Now, what is the safety? Now, we're talking about stem cell fat. Is it safe or not? I can share with you the Cell Surgical Network experience of 15,000 cases so far done by Cell Surgical Network, and there is no serious complications. Now, this is the first initial safety trial, which was done in 2017 and presented American Journal of Cosmetic Surgery. They have included 1,477 in IV. Remember, this is intravenous infusion. There were no serious adverse events related to SVF. There is no tumor formation. There is no emboli to the lung, and only very few, well, if you call them complication of liposuction. But the SVF itself, or the stem cell, did not do anything serious. Okay, so we finished the safety. Now, what is the efficacy? Are they effective or they are not effective? This is a paper published on knee osteoarthritis treatment of 2,683 patients. This is a significant number of patients. And you could see this is the efficacy of percentage of improvement of the joint symptoms, and they have certain parameters, of course, even the result after 5 years. So we do have significant improvement in people treated with osteoarthritis by local and intravenous injection of SVF. Now, regulations and quality control. Now, the Cell Surgical Network has International Review Board a protocol, approved protocol by International Cell Surgical Society, and these are approved and they can be used in many conditions. Each condition, like neurological or joint disease or cardiology or urology, each one has its own approved a protocol by ICSS. Now, uses of SVF protocol, and as I said, these are orthopedic, degenerative, cardiac, pulmonary, autoimmune, urology, neurological, cosmetic, ophthalmology. Application result in various medical. I will just share with you. It can, be used arthritis of all type, which is back arthritis, ankle, hip, knee, tendons, ligament, elbow, and shoulder. And these are the success rate, which is really amazing. You could see the success rate in cervical disease, 85%, thoracic, lumbar, and sacral joint diseases. If you look at the cardiac in this slide, the success rate in cardiac heart failure is only 60%, which is not bad, but I will go in details in my cardiac presentation later on about the meta-analysis of all international randomized trials. Now, success rate in back and neck is 76%. Success rate in hip joint, 80%. Shoulder joint, 80%. This is just one example. I'm not orthopedic surgeon, but you could see this is before treatment, and this is after treatment. You see the joint space has come back again, and this is due to regrowth of the cartilage. So the success rate in the knees is 82%. Now, neurological disease. There are protocols for management of Parkinson's disease, multiple sclerosis, muscular dystrophy, neuropathy, Alzheimer, stroke recovery and brain injury, partial spinal cord injury, and amyotrophic lateral sclerosis. Now, Parkinson's disease, the CSN has 222 patients treated, success rate 62%. Now, amyotrophic lateral sclerosis, the success rate is only 47%. Multiple sclerosis, a disease which has no treatment so far, the improvement in the patient's symptoms and signs is about 73%. Now, going to urology applications, this is a case of, if we have a urologist around, maybe Ali Thwaini is with us. This, he knows better than me. I am cardiologist. This is the picture of the granulation seen in interstitial cystitis, a disease which is very hard to treat. And the success rate of 109 patients treated was 71%. And this is the overall success rate of cystitis. Erectile dysfunction, excellent result of SVF. Of course, combined with a certain technique which is developed by a Cell Surgical Network called shockwave therapy. And these are the publications, but I'll pass them quickly. Peyronie disease, again, urologist knows that very well. There is a good success rate in Peyronie disease. This is the paper on Peyronie's disease and the success rate after 6 months. So the p-value is significant. Chronic pulmonary lung disease, I'm sure we have a lot of pulmonologists around. Stem cell has been, I will not call it stem cell, stromal vascular fraction of SVF so far has been used till 2018 actually. I'm sure we have more, is 622 patients. They were given intravenous plus minus nebulized stem cells or SVF. And the result is not too bad at all, 65%. You know, COPD as a disease with no treatment. Rheumatoid arthritis, success rate 87%. Fibromyalgia, so far the result is not too good, only 33% improvement. Lupus, very good result in lupus, 81%. SVF and healing, this is the SVF can be used in concussion, dementia, radiation damage, paralysis, trauma, bone marrow disease, age-related degeneration. The Regina track is the data registry which is used by Cell Surgical Network. Any center who start doing SVF therapy through CSN will have a record given and a database. All the informations about the 15,000 patients are documented in this data registry. What is the benefit of this data registry? You can use them at any time. You can publish paper. You can compare your result with these results, and a lot of things, information can be get from this registry. Insurance. It is very, very interesting that bioinsurance means another technique of after harvesting a cell, how can you keep it for future use? This is another era of stem cell therapy where you can take cell and save them in a bank for future uses if needed as emergency, where they can be expanded into millions and even billions, and then can be given back to the patient on need. The Cell Surgical Network has published a book called The Stem Cell Revolution, and this is available for free. Cell Surgical Network, who are they? They are, as I mentioned, they are more than 130 locations in the world. There are more than 500 physicians registered in this network, some of them in the US, many in Canada, Korea, Japan, Chile, Panama, Philippines, Singapore, South Africa, Thailand, Turkey, United Arab Emirates, and I think there is also Iran and India, if I'm not wrong. What do we do? They have the Cell Surgical Network. They do a lot of research. They do training for any member who join them. They are responsible for training them on liposuction, training them on equipment, training them on education, lecturing, supporting of physician, and malpractice insurance. This is very important because all over the world now, stem cell might be considered as a new technique. So there are many people probably against the idea of stem cell. That's why the Cell Surgical Network provide insurance cover for the doctors to be protected. This is a book, if any, I think I gave to Dr. Muthanna more than 50 copies. Where my interest started in stem cell therapy 2-3 years ago, I published 2 books, for junior cardiologist interventional book, but I wrote a chapter about stem cell therapy application in cardiology.